Well, in these times of totally unprecedented health crisis, it's very interesting that it's not always the politicians, so mired in partisanship and negativity, that we turn to. And as we're battling this coronavirus pandemic, Dr. Hilary Jones has become the most trusted voice in the medical profession on the air. So it's very appropriate that as we try and get through these really difficult times together, that every day here at The Sun and on Talk Radio, Dr. Hilary Jones will be here answering your questions. And Dr. Hilary, for 30 years, you have been the GP for this newspaper group. Obviously, you've been on air from TV-AM days right since the late 80s. But even you have seen nothing like this in your career.
I haven't, Dan. This is unprecedented, as you say. This is the biggest medical story in my medical career, both as a doctor and as a broadcaster. This is the biggest story that probably any media outlet will cover in living memory, because it's a global pandemic, and we haven't seen a global pandemic since 1918, 102 years ago. This will affect everybody's life for the foreseeable future, and it will affect the way people's working lives go ahead. So it'll have far-reaching repercussions, but of course my main interest is in keeping as many people healthy today as we possibly can.
Absolutely, and you are going to have a chance every day to ask Dr. Hilary those questions that you need answered from a professional who you can trust. And Hilary, we've had thousands upon thousands upon thousands of questions, and I'll tell you how you can submit yours at the end of the show. But first, of course, Dr. Hilary, monumental breaking news today. Prince Charles, 71 years old, the heir to the British throne, has tested positive for COVID-19. Your reaction?
Well, of course, this virus is a great leveller. It will be just as virulent for politicians and celebrities and monarchy as it will the homeless and the destitute. This respects no boundaries of wealth or privilege or whatever. Everyone is vulnerable, and this is a highly transmissible virus. Prince Charles, age 71, has tested positive. I would like to know how he managed to get a test, by the way, when healthcare professionals on the front line are still not able to get tested.
Well, there's a lot of outrage over that today.
I think this will raise a lot of questions, and it's absolutely right that healthcare professionals are in the forefront of testing. They need to know, because they could pass the virus on to their patients. They need to know whether they should stay at home or carry on working. We need them at work if we possibly can. So when one of our members of the monarchy are affected, we start to think, yeah, this could affect anybody. I know that they meet a lot of people in meeting and greeting, they shake hands, they're in close proximity, and we're too far down the line to go back and say that should have stopped months ago. We were learning about this virus all the time. No one could have foreseen that this virus from Wuhan would have been so transmissible so quickly, because the lessons of MERS and SARS, they were contained. A few hundred people died. Now we have tens of thousands dying, and the numbers are increasing.
At 71, he is in that high-risk group. Obviously, he is the heir to the throne. There's going to be a lot of worry about his health right now. But the reports from Clarence House is that actually his symptoms have been pretty mild, he's up and about, and he's working. Does that mean he's out of the woods?
No, he's got symptoms, I understand, that are mild. Most people have mild to moderate symptoms, and those symptoms will clear up within 7 to 14 days. So he's not out of the woods. He needs to have that period of self-isolation to see whether he feels better completely or whether things deteriorate. But he will know over the next few days whether things are not going his way and he's not improving. Obviously, we hope everything is fine. But most people who self-isolate, even if they don't know whether they've got the virus and they have, will get better. That's the important thing to know. Most people recover from this, but it's too early to tell for him.
The Queen is in her 90s. Of course, they did have some contact, we think, for the last time on the 12th of March. How concerned are you about the Queen and Prince Philip?
Well, what we know from data around the world is that people in their 90s are very vulnerable, even if they don't have pre-existing conditions. Prince Philip does. Now, they need to keep well away from everybody else. They need to make sure that they keep a physical distance of at least 2 meters from other people, and they don't want any visitors coming in. And I suppose that will apply to their courtiers and the people whose...
They're all gone. They're all gone. So they're on their own.
So they're on
As
their
Madonna
own.
said, coronavirus, the great equalizer. And of course, we are practicing here. We haven't had any contact today, Hilary. We're sitting 2 meters apart. We have a very limited crew at our London Bridge headquarters. So everyone around the world has to follow this advice.
One of the ironies about the monarchy coming down with this is that corona means crown. That's why when we see the spikes on the electron microscope of the virus, it's those little things that are like a crown.
You're going to be sparking a million conspiracy theories right now. Now, of course, thousands of questions from you have been sent in. We're going to go first to Rob Bates.
Why do we have to stay 2 meters away from other people? How is this distance arrived at? Is it arbitrary, or is there some kind of scientific calculation behind it? My second question is, if someone in my household is coughing and showing symptoms of coronavirus, do I have to stay 2 meters away from them as well?
We've come up with the distance of 2 meters because it is thought by scientists and eminent doctors that the virus is unlikely to travel that far when people talk to you, when people cough or sneeze. The virus is contained in droplets which will fall to the ground or be blown away by circulating air. 2 meters is a safe distance. There's a degree of safe leeway there. So that is why we say 2 meters. It is safe. What people need to know is that if someone's got a cough, of course it might not be the virus, probably isn't, but it could be. Dry, persistent new cough is one of the cardinal symptoms of this virus. So if anyone is coughing in your proximity, you keep well away. 2 meters at least, preferably you don't go near them.
Becky Nee has sent in the next question. She says, I'm meant to be moving in with my partner on Saturday. Where does the lockdown leave me? Am I allowed to move?
Okay, it's not places that transmit the virus so much as people. Now, if she's moving in with her partner, who is her significant other, if they've been in close contact before now, swapping houses, there's no reason why she can't move to be with her significant partner because they've been in close proximity anyway. However, if there are other people in that household, then that's a different matter because she's introducing the virus potentially to all those other people. So my advice would be, if there's just the two of them, it's fine. Think again if there's a household involved.
Great advice. Paul has sent in the next question.
Hi, Dr Hilary. When receiving online deliveries, what is the best way of avoiding infection through the goods?
When people deliver goods, it's possible that the delivery person could have contaminated the packaging with the virus if they're not taking the adequate precautions. So let's assume that there is virus on the packaging. So what you do is you bring the packaging in, you don't talk to the delivery man, you're keeping your distance. You take the packaging and you remove what's in the packaging and you put that in a safe place, and then you discard the packaging and then you wash your hands. Food itself will not contain the virus. If it's fresh fruit, you want to peel it and throw away what you've peeled. If it's vegetables, you're presumably either going to wash them under running water or you're going to cook them. And if you cook them, that will kill the virus. So these kind of precautions, and then you're going to wash your hands. And these kind of precautions will keep you safe.
Very important question now from Dee Carlisle. Thank you, Dee. She says, I'm 16 weeks pregnant and work in a call centre. There are around 50 to 60 people just on my floor and we sit at arm's length next to each other. They are trying to organise for people to work from home, but I don't know when this will be and who for. What can I do to keep myself safe, and should I really be working?
She should not be working. She's pregnant, she's in the vulnerable group. We want to protect her, we want to protect the unborn baby from the possible consequences of this virus. We don't think that unborn babies are at risk, but we're not absolutely sure, so it makes sense to take every precaution. She should not be at work for two reasons. Firstly, because she's pregnant, and secondly, because arm's length is not 2 meters. There are a lot of people in that call centre, and actually, if her employer follows the Public Health England advice, they will send her home, or they should do.
I hope they do. Wayne Tompkins says, I am one of the many people that have to go to work, but I'm wearing a mask when near people. So my question is, if they have the virus, will this stay on the mask? And also when I remove the mask, as I'm no longer near people, am I putting myself at risk?
He's in the group that has to go to work. He's an essential worker, understand that, and therefore he should practice the 2 meters physical distancing that everybody should be doing. There's no evidence that wearing a mask gives you any significant protection at all unless you've got symptoms and you're coughing and sneezing and you want to protect other people. Does it protect him? No, it really doesn't. The air is coming in above the mask, around the sides of the mask and underneath the mask. And some people even believe that masks can increase your risk because you tend to touch your face more.
Really?
So I would say if psychologically you feel that you want to wear a mask, do it, but it might not give you any further protection, and when you get home you don't need to wear that mask at all.
Well, it's good to know because they're very hard to find.
They are difficult to find, indeed they are. Not even healthcare professionals working on the front line can get enough masks right now, and they're the ones who should, in appropriate circumstances, be wearing them of a high standard, much more of high quality than the ones that you can buy in the shops or that construction workers are using.
Well, Dr Hilary is going to be back here every Monday to Thursday. If you want to send a question right now to Dr Hilary, you can either do it at thesun.co.uk/Dr Hilary, or you can find it on the Talk Radio website as well, talkradio.co.uk. And we're back with another edition of Ask Dr Hilary Coronavirus Explained tomorrow.